Welcome to new member orientation for the Jefferson Parish Medical Reserve Corps. If you're watching this training, you should have completed the following already. Signed up online through Better Impact, enrolled in the Louisiana Volunteers in Action or LAVA website, completed any professional license verification if you have a medical license and would like to operate under that license within the MRC, and completed a background check. If you have not done any of the following things, please email us at jpmrc@jeffparish.net so we can ensure that your application is complete. So let's move on to some basics about the JPMRC. It is our mission to supplement public health and medical response in disasters and public health emergencies within Jefferson Parish. We have 3 goals here at the JPMRC. The first is to provide effective and efficient response to disasters and public health emergencies. We want to be able to recruit a diverse membership with skill sets to respond to a wide variety of disasters and public health emergencies, and we want to make sure that diverse membership reflects our community. And 3, we want to provide robust training and exercise program to ensure that our members feel confident in their ability to respond to disasters and public health emergencies. Now we're going to go over a little history of the MRC. The Medical Reserve Corps is not just unique to Jefferson Parish. It's actually a national program created by the U.S. Department of Health and Human Services after September 11th. In September 11th, and also in disasters such as Hurricane Katrina, we see responders and local people just race to the scene of an incident wanting to help. However, these spontaneous volunteers are not trained and not credentialed. They don't know who the first responders are or what ways they can assist. And often, they end up getting hurt or causing more injuries and chaos in the scene. So in 2002, President Bush announced the creation of Citizen Corps, which created a number of volunteer programs across the country. The MRC was one of those projects that started with initial 42 community-based units. The goal was to have public health and medical professionals sign up, get licensed ahead of time, and trained to properly respond in a disaster. It turns out across disasters, about 10% of people who say they're a medical professional are not actually licensed to work. So it's important that we have this program so that we can increase our capacity during a disaster while having licensed professionals that can pass a background check. You can see in this timeline the other events that have taken place within MRC history. You can see we have events that respond to natural disasters and also public health disasters like H1N1, Ebola, Zika, and of course, COVID-19. Over the past 20 years, the MRC has grown to over 200 units across the country and more than 200,000 volunteers. They've also had a big community impact. Every MRC unit in the country works on different things based on the needs of their community. Some are engaged only in emergency response. Others participate in regular public health initiatives within their community. As you can see here, 68% of the disasters that MRC units respond to are natural disasters. 28% are infectious disease outbreaks. And you can see the other types of disasters listed here: human-induced or civil hazards, technology hazards, foodborne illnesses, hazardous material spills, and others. As you can imagine, COVID-19 is one of the largest MRC responses we've had. Many new MRC units were born out of the COVID-19 pandemic, including our unit here in Jefferson Parish. Units that worked during the COVID-19 response participated in a wide range of activities. It included testing sites, epidemiology and surveillance, medical surge, community screening, call center, behavioral health, community education and outreach, logistics training, and of course, mass vaccination sites. Here in Louisiana, our MRC units were important to keeping these services going. Within the New Orleans region, we already have 2 MRC units, one in Plaquemines Parish and one in New Orleans. The one in New Orleans was actively engaged in the COVID-19 response. You can see here a high-level overview of the responses in 2020. Many units, including those here in Louisiana, participated in continued COVID-19 tracking, also in a number of hurricanes. Across the country, people responded to wildfires, hepatitis A outbreaks, and winter weather events. Now we're going to go over activities that the JPMRC plans to engage in. The first thing the MRC will do is plan for hurricane responses. This includes preparing for potential evacuations and sheltering operations. Most of the time these will be for hurricanes, but sheltering could also be done under a variety of circumstances, including winter weather or tornadoes, both of which we've seen in the last year. We will also engage in community vaccination events to provide annual flu vaccines and COVID-19 vaccines to our community for free. This will also help us prepare for future disasters and pandemics requiring vaccinations. Finally, we'll engage with community members to increase disaster preparedness amongst our community, and we will prepare for a wide variety of disasters that we could potentially respond to. Some of these trainings will be done just within Jefferson Parish, and others will be done in coordination with the New Orleans Medical Reserve Corps. The MRC nationally has a number of core competencies so that all volunteers are prepared and have a same base knowledge. The 4 learning paths are volunteer response, volunteer preparedness, leadership opportunities, and volunteer support for community resiliency. You can see here the core competencies required for all MRC units. These core competencies will be covered through a variety of trainings that we will take throughout the year. Here within the JPMRC, we also have a number of tier levels based on the amount of training that you have participated in and the number of volunteer activities. Everyone starts at a tier level 4, so volunteers who have registered and are still working their ways through MRC orientation. Tier level 3 are volunteers with an introductory level of knowledge. Tier level 2 are an intermediate level where you start to take more advanced trainings and have shown competency during deployments. And tier level 1 would be advanced level of knowledge for volunteers who are given supervisory or specialized response roles. Next, we're going to go over deployment and activation procedures. The first thing to know is it's important not to self-deploy to any response without an assigned shift. For example, if you hear on the news that Jefferson Parish is opening a shelter, please don't go directly to the shelter. Instead, wait for an alert to be activated. Depending on the type of emergency, you will get an alert. If it's a planned thing, like a hurricane that we see coming a number of days in advance, all of the shifts will be listed in Better Impact, and you might get an email to sign up. If there's a train derailment which requires immediate response, you might get a text or a phone call to come to the scene. Volunteers are never required to respond for a specific deployment and should respond to their availability inquiry. Some shifts will be set for specific people with backgrounds. For example, at a mass vaccination site, there will be a set number of medical providers and nurses, and then non-medical staff. You will only be able to see the shifts that you qualify for. Once you sign up for a shift, you will be provided with information about location arrival, who the point of contact, and anything that you need to bring with you. Once you complete onboarding with the MRC, you'll be given a t-shirt to wear to your response, along with any other specific instructions, such as closed-toed shoes. We will also have MRC vests on site in case your shirt is not available or we are multiple days into the event. After events, we want to make sure that we collect all activity logs, evaluations. We'll also do daily team debriefs so that we can learn lessons from each event to improve trainings, plans, and procedures. We'll also want to complete and finalize documentation within Better Impact to make sure all of your volunteer hours are documented. Here in Jefferson Parish MRC, we have a code of conduct, and I want to make sure that you've gone over this. This code of conduct is also listed in your policy and procedures manual, which you should have already received through the Better Impact portal and signed verification that you have received it. Our code of conduct states, we respect that our members are volunteers and value their time, and no member will be required to respond to any specific deployment. We value the experience, knowledge, and skill sets of our members, and we will do our best to match our members with roles that will allow them to use or improve their experience, knowledge, and skill sets. We believe in having a diverse membership that reflects our community and will improve our ability to respond to the needs of the parish, and we will strive to recruit members that reflect the diversity of Jefferson Parish. We value input from MRC members and encourage opportunities to improve the JPMRC. If you have examples of responses, trainings, and community events you would like us to participate in, we highly value that feedback and would love to discuss those options with you. We prioritize the safety of all of our JPMRC members and the community members that we are serving. And we respect our members and the culture of our communities. Our members will model behavior that respects the human rights of all our members of our community and will strive to learn about cultures within our community to better meet their needs. Next, we'll go over some member expectations. We are committed to maintaining a safe environment for all those we serve and for all of our members. When acting on behalf of JPMRC, members are expected to conduct themselves in a professional manner and agree to conducting myself in a respectful manner, exhibiting good conduct, and being a positive role model. I will display respect and courtesy for all other employees, volunteers, program participants, visitors, clients, property, and supervisors. I will keep personal opinions and actions separate from those made as a representative of this organization. I will not misrepresent my professional credentials, experience, knowledge, or skill sets, and I will work within the scope of my practice. I will work cooperatively as a team member with employees and other volunteers. I will avoid conduct both on and off duty which would jeopardize program effectiveness. I will not solicit gratuities, gifts, or bequests for personal or professional benefit, and I will provide a safe benefit by not harming anyone in any way, whether through discrimination, sexual harassment, physical force, verbal or mental abuse, neglect, or other harmful actions. While volunteering with the JPMRC, you may interact with the media and the public. JPMRC members are not authorized to speak to the media. If you are working at a deployment site such as a shelter or a vaccination site, please direct any media who approach you to a site supervisor or the public information officer. It's also important to note that sometimes as a JPMRC member, you will learn information before the general public because of your role in the response mission. For example, you might know in advance that we are planning to issue a mandatory evacuation because you have been offered a shift for the evacuation response. If this information has not been issued publicly yet, we expect you to keep that information to yourself as a critical role in the response. JPMRC follows incident command structure, which is a set way outlined by FEMA of how emergency response is supposed to occur. Every incident and response site has an incident commander on site. So for example, at a shelter, we often call this the shelter manager. or at a mass vaccination site, there will be an incident commander, one person who's responsible for the operations at that site. Under the incident commander falls the public information officer, a safety officer, and a liaison. Then you have groups of staff working under operations that are doing the current day's task, planning, which looks at the next few days out and what we might need, logistics, who are managing supplies, and then finance and administration, who are doing the paperwork and make sure everything is paid for. Most of the time, JPMRC are going to fall under operations. Every once in a while, you also might be asked to participate in planning or logistics if necessary and if you have that specific skill set. It's important that JPMRC members receive regular training so that they're prepared to respond. Trainings will often be made available online through the Better Impact portal or in person, where the training registration will occur on Better Impact. Once you're a full member, you will have access to see the list of upcoming trainings. Now I'm going to move in to our HIPAA training. It's important that all of our MRC members understand the basics of HIPAA because we will often come across personal protected information. Today we'll go over our mission statement and purpose, what is HIPAA, patient rights, and HIPAA in emergencies. It's important to note that Jefferson Parish is not a HIPAA-covered entity because we do not directly bill health insurance companies. However, we may have access to personal and health information about the people that we're serving. There may also be times that we are engaging with the State Department of Health or with HHS and receiving data about individuals that is HIPAA covered. This training is mandatory for all of our JPMRC members so that you understand how to handle personal and health information. A volunteer is responsible and will be held accountable to follow the HIPAA rules and regulations that may or may not be presented in this training. As you can see, this is the JPMRC mission and goals, which we covered in the previous training. For those of you who do not have a public health or medical background and have never taken HIPAA training, HIPAA stands for the Health Insurance Portability and Accountability Act of 1996 and is a federal law that required the creation of national standards to protect sensitive patient information from being disclosed without a patient's consent or knowledge. The U.S. Department of Health and Human Services, or HHS, issued the HIPAA privacy rule to implement the requirements of HIPAA, and the HIPAA security rule is what protects the subset of information covered by the privacy rule. The privacy rule has standards to address the use and disclosure of individuals' health information, also known as Protected Health Information, or PHI. The privacy rule also contains standards for individuals' rights to understand and control how their health information is used. A major goal of the privacy rule is to make sure an individual's health information is properly protected while allowing the flow of health information between healthcare entities and their insurance company and to protect the public's health and well-being. So now we're going to watch a short video on why HIPAA is important for healthcare providers.
Why HIPAA compliance is important for healthcare professionals. This short video will explain why HIPAA compliance is important both personally and professionally for healthcare professionals. Why HIPAA is unavoidable for healthcare professionals. The Health Insurance Portability and Accountability Act, or HIPAA, was passed in 1996 with the original objectives of improving the portability of health insurance, modernizing the flow of health information, and combating waste, fraud, and abuse in the health insurance and healthcare industries. It wasn't until some years later that the HIPAA privacy rule defined protected health information, and standards were published to restrict uses and disclosures of protected health information. The HIPAA privacy rule also gave individuals the right to access their own protected health information and the right to request that their information be amended if found to be inaccurate or incomplete. To ensure individuals are aware of their rights, covered entities are required to provide patients with a user-friendly notice of privacy practices. The security rule was added to ensure covered entities implement appropriate administrative, technical, and physical safeguards to ensure protected health information is kept private and confidential. Since the passage of HIPAA and the publication of the privacy and security rules, HIPAA has evolved to keep pace with the changing landscape of the healthcare industry. The subsequent Enforcement Rule, HITECH Act, Breach Notification Rule, and Omnibus Final Rule have influenced many of today's workplace practices for healthcare professionals. But these are not the only reasons HIPAA is important to healthcare professionals. HIPAA compliance helps foster patient trust. HIPAA is more than a collection of regulations that has to be complied with. When applied effectively, HIPAA creates and maintains a professional environment that protects every patient's rights and every patient's data through a series of best practices. Creating and maintaining a professional environment in which patients understand their rights and understand that their data is protected is important because patients tell healthcare professionals intimate details of their lives that few other people may know. If a patient is not confident that their privacy is being respected, they may withhold information, which could compromise the delivery of care, resulting in an avoidable deterioration of the patient's condition, with potentially long-lasting consequences for their health. Therefore, complying with HIPAA plays an important role in fostering patient trust and keeping patients safe. Better patient outcomes raise the morale of healthcare professionals and result in a more rewarding work experience. The personal career risks from HIPAA for healthcare professionals. Under HIPAA, healthcare organizations are required to have a sanctions policy and enforce its provisions if a member of the workforce fails to comply with policies and procedures designed to safeguard protected health information. Therefore, even if a healthcare professional unintentionally violates HIPAA, their employer must sanction them in order to avoid violating HIPAA themselves. Most sanction policies have a tiered penalty structure depending on the nature of the violation, the consequences of the violation, and the healthcare professional's degree of neglect. The penalties can range from verbal warnings to written warnings, suspension without pay, and termination of contract, loss of professional accreditation, and even law enforcement investigations and criminal proceedings. The involvement of law enforcement implies that there is sufficient evidence to pursue a criminal conviction for a violation of HIPAA, and many former healthcare workers have been given prison sentences for knowingly violating HIPAA. Even if a criminal conviction is not pursued by law enforcement, affected patients may have the right to take legal action under state laws. Even minor HIPAA violations can have negative consequences for healthcare professionals. It's a requirement of HIPAA that sanctions are documented, which can make it difficult for a non-compliant healthcare professional to get another job, and if disciplinary action for non-compliance is reported in the media, this can have repercussions for an individual's personal reputation. Organizational HIPAA risks for healthcare professionals. Although HIPAA training is provided by teaching institutions, employers, and other healthcare organizations, the content of HIPAA training may not be sufficient to prevent unintentional HIPAA violations by healthcare professionals due to a lack of knowledge. This is because, under HIPAA, covered entities are only required to train members of the workforce on policies and procedures that relate to protected health information if they're relevant to the healthcare professional's role. Healthcare organizations are under pressure to do as much as possible with limited resources, and sometimes this will result in them only providing the minimum necessary training to comply with the HIPAA training requirements. Consequently, the potential exists for a healthcare professional to violate HIPAA if their employer has not developed a procedure that addresses a specific scenario, or if the employer has not trained the healthcare professional on a procedure because they don't believe that it's relevant to the healthcare professional's role. In addition, HIPAA violations can occur when shortcuts are taken with compliance to get the job done. If the shortcuts are allowed to continue, they can develop into a cultural norm of non-compliance that becomes an accepted practice. Healthcare organizations are aware that this happens, and where it's been identified, refresher HIPAA training should be provided to reinforce HIPAA compliance. However, as with policy and procedure training, it may be impossible to provide comprehensive refresher training with limited resources. While it could be argued that the employer is at fault for failing to train the healthcare professional or failing to provide refresher training in order to reinforce HIPAA compliance, organizations are reluctant to acknowledge liability for HIPAA violations attributable to a lack of training because it demonstrates negligence on their part for failing to identify the potential for a HIPAA violation in a risk assessment. As mentioned previously, a HIPAA violation places a demand on resources and can result in investigations by the Office for Civil Rights, reputation damage, and disruptions to the workforce. Organizations would rather not have this administrative overhead if it can be avoided, nor admit to an oversight in their risk assessments. Consequently, if you inadvertently violate HIPAA due to a lack of knowledge, or because a cultural norm has been allowed to develop, you could be sanctioned, albeit unfairly. The best way to avoid this scenario and the negative consequences discussed previously is to ensure that your knowledge of HIPAA covers every area of your role and any roles you may be required to cover in the future. To achieve this level of knowledge, you should take advantage of third-party HIPAA training courses that provide you with an in-depth knowledge of HIPAA and its rules and regulations. Doing so will help make you a better healthcare professional, and being able to demonstrate that you've undertaken additional HIPAA compliance training can give you an edge in the job market and improve your future job prospects. Get trained on HIPAA. Protect your career. Given the choice, most healthcare professionals would prefer to work in an organization that operates efficiently to deliver better patient outcomes, where morale is high, and they can have a more rewarding work experience. HIPAA compliance cannot guarantee healthcare professionals will enjoy a more rewarding work experience, but it can contribute to operational efficiency, better patient outcomes, and higher morale. HIPAA compliance gives you professional peace of mind. Conversely, the failure to comply with HIPAA can have a negative impact across the board. But because of the many pressures healthcare organizations are under, HIPAA training is not always comprehensive or reinforced, potentially leading to unintentional HIPAA violations due to a lack of knowledge, which could have serious personal consequences for healthcare professionals. The best way to avoid the consequences of unintentional HIPAA violations is to take responsibility for your own knowledge of HIPAA, and then use that knowledge to work in a HIPAA-compliant manner in order to foster patient trust, keep patients safe, and get more from your vocation.
Next, we're going to cover patients' rights. Patients have a right to request a copy of their medical records. Patients have the right to know with whom their health information is shared. Patients have a right to know why their PHI has been shared. Patients have the right to determine how they are contacted, and patients have the right to object to certain disclosures. Now we'll watch a short video that covers patients' rights.
It's important to note that the Health Insurance Portability and Accountability Act also reinforces patient rights and their control over personal information. So what are patient rights under HIPAA? In addition to introducing new standards of data protection in the healthcare industry, HIPAA grants individuals new rights and more control over their medical information. HIPAA gives patients the right to control who may receive their medical records and what information they may receive. HIPAA patient rights are an important aspect of the legislation. Employees should be aware of these rights and how they may affect their own work practices. It should be noted that parents have rights over their children's data while the children are still minors. HIPAA patient rights are defined as follows: the right to receive a notice of privacy practices. Patients must be informed about the uses of PHI and with whom it will be shared. The right to inspect PHI. Patients can ask to see a copy of their health records. The right to amend PHI. Patients can request corrections of any errors in their health records. The right to restrict disclosure of PHI. Patients can limit with whom PHI is shared and for what purposes, such as marketing. The right to choose how PHI is received. Patients can ask for a copy of their PHI using different methods, such as by telephone or mail. The right to access the PHI disclosure accounting log. Patients can request access to this log, which contains information about with whom and for what purpose PHI was shared. The right to file a privacy complaint. Patients can complain to their health provider, insurer, or HHS within 180 days of a privacy violation being discovered. The right to send or receive ePHI. Patients can request digital copies of their medical records be sent to them or any third party whom they name as their nominated representative. Healthcare professionals should remember: HIPAA gives patients rights over their healthcare data. Patients must be informed of how their PHI will be used and disclosed, and they can request access to logs of disclosures of their protected health information. Patients can obtain a copy of their healthcare data in paper or electronic form and request that errors be corrected. Patients can restrict uses and disclosures of their protected health information. Patients have the right to file a privacy complaint, but cannot sue for a HIPAA violation.
Next, we'll cover what is protected health information, or PHI. PHI is any information that is a unique identifier for a particular individual. This includes their name, address, any dates, so their date of birth, date of death, age, their phone number, fax numbers, email address, social security number, medical record number, any health plan or insurance information, account numbers, certificate and license numbers, vehicle identifiers, or full face photos. It also covers all of their health status information, such as a diagnosis or medications. We want to make sure that we are protecting this information. So the information is not to be emailed or texted unless it can be encrypted. All information is to be kept in a secured area. There needs to be a minimum amount of information needed to complete a task. We have to protect all potential data that could be an identifier and be mindful of how we're gathering data. We want to make sure that we are not leaving patient paperwork lying around, sharing passwords, or disclosing information to unauthorized persons. A breach of PHI is any impermissible use or disclosure under the privacy rule that compromises the security or privacy of PHI. This is called a breach. In the event of a breach, you must immediately report it to the Medical Reserve Corps coordinator. There's a lot of confusion about when health information can be shared without someone's permission. And often people think that the HIPAA privacy rule can be suspended during a national public health emergency. Generally, this is not done. However, the Secretary of HHS may waive certain provisions of the rule under the Project BioShield Act of 2004. There are a number of bulletins that will come out from HHS in a disaster explaining what HIPAA rules may have been suspended for that disaster. It's also important to know that public health information may be used and shared if there is a public health good that the general public needs to know about. When working at a deployment site, there's a number of places you will see PHI. This includes registration or intake forms, prescription bottles, health or medical charts, medical bracelets, electronic health records, driver's license or ID, social security cards, and the information that patients are telling us. It's important that we protect all this information, that we don't leave papers lying around, that we have quiet conversations with individuals we are working with, and that we are not providing information to people who do not need it. We also want to make sure that we receive patient consent before we release information to others. So here are a number of frequently asked questions about how to handle PHI on an MRC deployment. The first question is, what do I do if a family member or friend is a patient? This is quite common in Southeast Louisiana, where everyone knows everyone. It's important that if a friend or family member comes to a vaccination site or a shelter that you're working, that you try and find someone else to directly gather patient information from that individual. If there's no one else to work directly with them, you should ask first. Make sure they understand that you are providing them assistance in a professional capacity and that you will keep all of their information private. Question number 2, who can I share patient information with during an MRC deployment? PHI should only be shared on a needs-to-know basis. So for example, if you are working a shelter and someone is diabetic, the food team needs to know that information so that they can provide food that's appropriate for the medical condition. However, individuals at registration and running logistics do not necessarily need to know that information. There's also information that might be shared with partner agencies, like the Red Cross or the Louisiana Department of Health or a hospital. It's important that we have signed consents before we share that with outside agencies. Question number 3, what types of patient information will I come across during an MRC deployment? The types of patient information you will come across depends on the response site. At a mass vaccination site, you might gain very little information, but it would include a patient's name, date of birth, address, maybe a contact phone number, and any medications they might be allergic to, or if they're pregnant. If someone is staying in a shelter with us, we might be gathering more information so that we can provide adequate care, such as physicians, diagnoses, and medications. Question number 4, where do we keep forms within a shelter or vaccination site? At any of these sites, we will have forms for people to complete, and they need to be kept at either a nursing station or a registration station, and not just left laying around within a shelter or vaccination site, where non-staff might come up and see them. Question 5, what do I do if I witness someone else breaking HIPAA laws? If you or someone else at a response site has a breach of PHI, you need to immediately form a supervisor or the MRC coordinator so that we can address the situation. We can remediate any efforts, we can clean up paperwork that might be lying around, and complete a report for the risk manager if that becomes necessary. This is the end of our HIPAA and MRC orientation training. Thank you so much for joining, and you can follow the next steps on the Better Impact website to find out how you can attend trainings and respond to an MRC deployment. Thank you for joining the Jefferson Parish Medical Reserve Corps.